Hey guys, it's Memorial Day weekend. Happy holiday. We're going to talk to you all real quick about when to and when not to go to the hospital, specifically the emergency department. So, when should you go to the emergency department? Airway, breathing, circulation, or trauma. So, anything that obstructs your airway or makes it hard for you to be able to breathe. Breathing. Is it hard to breathe? Is it from COPD exacerbation where you just can't catch your breath and you're talking and have to breathe every couple words because it's so hard to breathe? Is it chest tightness? Does it feel like you're having an allergic reaction where it's swelling and itchy? Circulation, anything that's making the blood not go around your body or outside of your body. So, did you get into an accident? Did you cut your arm? Did you cut an artery? Are you having chest pain? Are you having some sort of blockage in your chest, your lungs, or your legs, or even a stroke in your head that's causing blood not to be able to go around in the body like it should? Trauma's the other thing. This is Memorial Day weekend. A lot of people do a lot of dumb things. You should not hold firecrackers and fireworks in your hands while your best friends light them. I understand you think it's fun, but it is not fun on the after effect. Those are things that you need to do to be safe, but those are things that need to go to the emergency department where you have a team of nurses, doctors, and surgeons there to be able to treat you. If you wake up in the morning and you're hungover and you're just puking and you have diarrhea and you just overall feel like crap, that is when you need to go to a Med Express that can just do small, simple things like Zofran, which is an anti-nausea medication, or something like giving you some IV fluids to help your hangover so you're not so dehydrated, because when you drink alcohol, you get dehydrated. Other things that you may need to go to those Med Express for would be flu-like symptoms, symptoms of like a stomach bug, things of that nature, because again, those can be treated there and you'll get the care quicker in something like that. Things to go to your primary care doctor for. All the reasons that I listed for Med Express can also be treated by your primary care doctor. However, they're only open a selected days of the week, whereas Med Express is usually 12 hours, 7 days a week. I think some Med Expresses are actually staying open later into the night to help with that, so that is also a plus. Primary care doctors, they treat the boo-boos and the ouchies. They're your PCP, they're who know you the best. That's who the ER docs and the other teams are going to tell you to follow up with, because they know you from head to toe, inside and out. So it's best to see them if possible. Being that it's a weekend, I understand certain things are closed. You may think that, hey, you need to go to the hospital. That's okay too. However, just understand that going to the hospital, it works off of a tiered system. So you no longer have, well, if I call 911, I'll get in faster. That is not how it works anymore, not in today's time. Now you go from the ambulance to a triage provider or a triage nurse, and they have a set category. And if you meet certain pieces of category, that determines whether you go to certain rooms or get seen first, or if you go sit in the waiting room until another bed can be opened up. So everybody thinking that, hey, I can call 911, get out, get into the ER quicker, that is not the case. So with that, I conclude this in stating that have a great, safe holiday. Like I said, know who to go to and when, because it'll make your weekend a lot more enjoyable, and it will also keep a decrease of overflow that doesn't quite need to be overflowed. This healthcare system in the country is already under a strain. COVID hit, we're 5 years post-COVID, and we're still just now recovering from what we had damage from with COVID-19 virus. So with that, still have fun, still enjoy yourself, but know when to go, when not to go, and who to go to, and that way you get the care you need in the manner you feel you need it, and you're not stuck waiting in a hospital room in the emergency department for a bed upstairs when you don't need it, or when you don't feel like it's that quite that severe to be warranted. Again, be safe. Have a great weekend. Take it easy.